Hello, everyone, and welcome. We're so glad you could join us today. As others roll in, feel free to introduce yourself in the chat, share your name, where you're joining from, and the organization you're with. But I'll go first. As many people come in, I'm Jordan Tobias, Manager of Grants and Programs here at the Foundation for Financial Planning. I'm also joined by my colleague Rachel Roth, who's our Senior Director of Grants and Programs. But today's session will focus on how financial planners can better support clients navigating a cancer diagnosis, including strategies for addressing financial challenges, key planning considerations, and how to approach these conversations with care and resources. But before we get started, I like to take a moment to introduce FFP and the question that drives our work to expand access to pro bono financial planning. So, at the center of what we do is a simple but transformative question. What changes when people in crisis gain access to trusted financial advice? And so, for 30 years, we've seen the answer firsthand. Families overcome hardship, regain stability, and start building stronger futures. So, our goal is to ensure that anyone navigating financial challenges can access high quality financial advice and guidance. And so we pursue this mission or this work in three major ways. So, first, we help develop and support pro bono financial planning programs in partnership with nonprofits nationwide, providing grant funding, technical assistance, and resources to ensure that these programs thrive. Second, we recruit and train financial planners to do pro bono work and connect them directly to volunteer opportunities through our national platform called ProBonoPlannerMatch.org. And then lastly, we drive the pro bono movement forward through our research, partnerships, and awareness initiatives that elevate the pro bono financial planning across the profession. And then, so we have a range of resources to support CFP professionals providing pro bono service. First, we have our pro bono financial planning volunteer training, which is a free CE eligible online course that helps advisors understand how to effectively serve clients with low to moderate incomes. And it only takes about an hour to complete. And again, it's CE eligible. And then we provide worksheets, webinars, and user-friendly disclosure forms to support your client engagements. Again, we have ProBonoPlannerMatch.org that connects CFP professionals with volunteer opportunities at nonprofits nationwide. And then finally, we provide E&O liability insurance coverage to CFP professionals who take our training and volunteer through our platform. And then before I turn things over to our speakers, I just like to take a moment to invite every CFP here to imagine how you can help strengthen the pro bono financial planning movement. By being here today, you've already taken the first step, but if you haven't already, we encourage you to subscribe to our newsletter, create a volunteer profile on ProBonoPlannerMatch.org, and consider partnering with a nonprofit on our platform. If you'd like to talk more about how to get involved, Rachel, myself, or any of the members listed on the screen here would be happy to connect after this session. But with that, I am excited to introduce our guest speakers from two of FFP's incredible nonprofit grantees, CancerLINC and Angel Foundation. I'll start by turning things over to our CancerLINC team, Patricia Green, who's a program manager, and Taylor Jessee, who is a CFP and a CancerLINC volunteer. And then afterwards, we'll hear from Norah Barrett-Cooper, who's the Director of Mission Delivery at Angel Foundation. So let me turn here. And then Patricia and Taylor, I will hand it off to you.
Hi, everyone. I'm so excited to tell you all a little bit more about what CancerLINC does. So we are a Central Virginia-based nonprofit that links cancer patients and their families to legal, financial, and community resources to solve the non-medical obstacles that arise with a cancer diagnosis. So with the help of over 160 volunteer professionals, we address issues often experienced by cancer patients, such as medical debt, life planning, legal documents, employment issues, health insurance denials, housing insecurity, and we also do community resource navigation in-house, as well as some additional things. Um, so approximately 90% of the patients we serve are below the federally defined housing and urban development poverty line. And so, for example, that looks like a household of one person can make up to $65,000. And so we work with the FFP to connect CFP professionals to our patients for one-on-one financial advice and guidance. And we have about 20 financial planning volunteers who dedicate their time and expertise with us, Taylor Jessee being one of them. Taylor, do you want to introduce yourself?
Sure. Hi, everyone. My name is Taylor Jessee. I'm a CFP and a CPA. Like Patricia mentioned, I've been volunteering with CancerLINC for about 6 years now. I am a solo practitioner. I founded Impact Financial here in Richmond, Virginia, almost exactly 3 years ago. But I'm happy to be here and look forward to a great discussion.
Thank you, Taylor and Patricia. I am Norah Cooper. I am the Vice President of Mission Delivery at Angel Foundation. We are a Minnesota-based nonprofit. We were founded in 2001, and our goal is to help adult cancer patients get the resources they need throughout their cancer journey. So we do this in a number of ways. One is through straight financial assistance. We provide a one-time grant for anyone who meets our economic guidelines for up to $1,000. That's for someone who just needs a quick cash infusion. We also provide all sorts of different kinds of education, including nutrition education, helping parents or grandparents or aunts and uncles talk about their diagnosis with kids in their lives, and providing coping tools for those kids. We do events around Minnesota special to these cancer patients. And then we do a program called Financial Cancer Care, which is the one I want to talk about today. So Financial Cancer Care is, if you can skip to the next slide, Jordan, was created to help patients create a long-term financial strategy to help address the financial burden of cancer. We're going to talk in more detail about what that financial burden looks like in just a moment. But first, we're going to talk about the intervention that we designed with the help of the Foundation for Financial Planning to ensure that cancer patients have financial relief and a plan for how to tackle the challenges, the significant challenges that cancer creates in their finances. So one thing that we've heard a lot from our clients is that they are actually nervous to talk to CFPs, that they are frankly generally in a kind of a financial toxic soup and can be embarrassed even if they had been saving and they were in a great financial spot. Cancer can really change that, and we'll talk again more about that. But they're a little embarrassed to have people see their finances. For some people, they weren't planning to be where they are and are embarrassed even before cancer hit. So we worked with a variety of certified financial planners to create a 1.5-hour workshop before they're paired with a CFP to have time to really digest sort of a financial 101. If you look on the right side of your screen, you'll see what we call the financial house. It's helping cancer patients build that financial house. So again, pretty practical advice, defining your financial goals, evaluating your needs and assets, exploring your resources, risk and protection management, retirement planning, and then of course, legacy planning as well. At that point, many of our patients are really excited to pair with a CFP. Those workshops are run by CFPs as well as our Angel staff. And they become really excited to get that chance and pair with a pro bono CFP for 1 to 3 sessions. So that is our intervention. Let's talk now about what brings us to need a program like financial cancer care. And that really talk about the financial toll that cancer takes on people. So in 2025, roughly 2 million people were diagnosed with cancer nationwide. Well, that number is, of course, ginormous. I don't think it's probably a huge surprise to anyone on this call. Most likely every single person on this call has been either directly or indirectly impacted by cancer. It is a illness that goes through every human demographic, and hits every community in the United States. What we often don't talk about, though, is the financial toll that cancer can take. There are significant out-of-pocket costs, even for insured patients. So we know for people with insurance, things like premiums, deductibles, copays are very expensive and can be very challenging. The hidden costs are things we don't often talk about. We don't talk about travel. A lot of cancer patients need to travel to treatment sites, so particularly if they're in rural communities, but even people in urban communities might need to travel to additional sites that can specialize more specifically in their type of cancer, to get things like scans, like MRIs. We don't talk about lost income. Most people need to take significant time off from their work, or can be fired because they can't make their work. And then there's things like uncovered services, that we think a lot about at Angel Foundation. Things that could be anything from, I need my house cleaned, so it's sanitary, but I'm too exhausted to clean my house. How can I do that? To things like immunotherapies, these extraordinary scientific breakthroughs that in many cases are ending cancer for people with really unique scientific ways, but are often not yet covered by insurance. So to be able to pay for them, the cost is just extraordinary. All of this, of course, creates enormous stress and challenges for anybody going through cancer. But there's a really specific term that the cancer community uses to talk about this challenge of both having to work on your survival, to fight this disease at the same time that you're working on your finances and all the challenges that are coming with it. And that's called financial toxicity. It really talks about the direct high costs like copays, the indirect costs like lost income. And studies have shown that patients who have financial toxicity report having a lower quality of life, more symptoms, and more pain than people who are not experiencing financial toxicity. It's also really important to note that financial toxicity affects not only the patients, but also the family and caregivers, and we'll talk more about that in a moment as well. So I want to talk about what this looks like in more detail. So 73% of cancer patients are going to go through some of that financial toxicity. That's the vast majority of cancer patients. But let's break down the numbers a little bit to understand what that can look like and the severity of that toxicity. 62% of cancer patients report being in debt due to their treatments. 1 in 3 patients delay or forego treatment because of the high costs. So this also means that patients often end up skipping doses of medication that they very much need. They might take less medication than prescribed to save it, or they just don't refill their prescriptions to save money. It means that cancer patients are 2.5 times more likely to go bankrupt than anybody else. And 42% of individuals diagnosed with cancer will deplete their entire savings generally in the first 2 years after their diagnosis. So given all of this, we find that patients are often reallocating resources away from things that are otherwise, of course, essential, like food, in order to pay for their medical debt or their cost of treatment. There's a wide variety of stats around food insecurity for people going through cancer. It can range anywhere between 17 and 55%. But we do know a large percentage of cancer patients do face food insecurity. And we are, of course, seeing this rise a little bit now with challenges with SNAP here at Angel Foundation as well. But this is not just a problem for the uninsured. I want to talk a little bit about what that looks like. If you can go to the next slide. On the left, you'll see the rising medical debt in the US. That's not just for cancer patients, that's overall in the US, that we're seeing a very slow but important rise in medical debt. And we know that many more patients are now choosing or have to choose high deductible plans, insurance plans, which shift more costs to families up front, which causes all sorts of challenges. They pretty much are immediately plunged into debt in January. And then in order to pay for other incidentals or things like food or housing, they're using credit cards, which then creates a lot more challenges and a lot more debt. These are things that all of you know a lot more about as CFPs than I do. But what I do know is it creates this really toxic soup that makes it very hard to get out of. And it involves the whole family. It's not just the patient. So let's look now at what that means for families. We know that a quarter of US cancer patients have dependent children. Most of those patients are of working age. So they either have reduced hours, leave, or job loss. That's about 65% are saying that is what happens to them when they have cancer. And that financial strain of losing time, losing hours can lead to housing instability. It can lead to food insecurity and can have, of course, school impacts for students as well. In addition to the patient being out of work, we often see that family caregivers, who are typically the partner or spouse, may also have to leave work, which doubles the financial impact and makes it that much more challenging for families. So this stress, this fear, this financial toxicity that we talked about can literally change a patient's health outcome. We know from earlier slide that it can decrease their quality of life, so they're experiencing more pain. It can also decrease their treatment adherence, so they might not take their medications, as we talked about. But it also undermines their very chance of survival. So as depressing as these slides have been, and as challenging as they are to hear, there is some hope on the horizon. And I want to talk about it. We learned about this hope from a 2021 research study from the Levine Institute, which was a course funded by the Foundation for Financial Planning, who studied a program that included a CFP, pro bono CFP intervention, much like financial cancer care, and the one that CancerLINC will talk about in further detail, and saw a 53% higher survival rate than those who did not receive the same treatment. So again, I think that bears repeating because it's such an extraordinary number. Patients who went through that program saw a 53% higher survival rate than those who did not receive the same intervention. In addition, there were better overall quality of life metrics than those who didn't receive these interventions. So we know how important the work with pro bono CFPs are for cancer patients, and we've seen the real financial challenges of cancer. And I want to turn it now back over to Patricia to talk about the considerations you need to make when working with cancer patients to make sure these programs are successful.
Thank you so much, Norah. So again, for my portion of this presentation, I am going to be sharing with you all some considerations to keep in mind when working with cancer patients and their families. So the first topic I want to get into is the importance of knowing where the patient is in their cancer journey. And this is because different periods equal different needs. Both related to the financial planning that you all will be doing, but then some other considerations that are going to indirectly affect the work you're doing. So as you can see here, I've got an infographic on what the typical cancer journey looks like for someone. And so we're going to start off with someone who is newly diagnosed. So at this point, if you are working with a cancer patient who's newly diagnosed, more likely than not, they are going to want to come to you and get some help with contingency plans and what if scenarios. One of the most common questions that we get from folks is how long can they continue to pay their bills, their mortgage, their rent, whatever it may be, if they need to stop working completely or go down to part-time hours. So helping them develop financial plans for scenarios like that or other, again, different contingency plans is a common theme for someone who is newly diagnosed. So once someone gets into their treatment choice and then their actual therapy cycles, By that point, the patient usually has a little bit better of an idea of the time that they will need to take off from work, if any, the length of their treatment. Maybe they're getting an idea of the side effects from their treatment as well. Another consideration is that when they're in treatment, they're likely to have some side effects from it, and so that may affect their engagement with you all. And we'll get into a little bit more about how that's going to look in my next slide. But so at this point, they maybe have a better idea of what the next 6 months is going to look like, and so they need your help developing a financial plan um, related to that. And if you're asking yourself, well, what's the point of working with someone right at diagnosis instead of just waiting until they have more information? That it depends on the person. Some people, when they get diagnosed, they just like to come up with plan A, B, and C right away. They don't want to wait until they've got more information. And sometimes that process can take a while to come up with a treatment plan. And so they want to get started working on things ASAP. It's just going to vary by person and their preference and how they're going to be dealing with the stress of their diagnosis. So then, towards the end of my infographic, we have a divergence of the journey. And so we have remission, or then we have disease progression. So if you are working with someone who is in remission, then more likely than not, they have a good-looking prognosis. They are going to want to maybe learn how to get back on track with their finances. An example would be maybe they had to take money out of their retirement accounts, and so they want to get back on track with retirement spending. Another common theme is folks will have a lot of medical debt. As Norah was mentioning, medical debt with cancer patients is such a common issue, and so maybe they need help with that. But another piece too to cancer patients in remission is that the costs do not end there. We have a cancer patient who actually just requested to get help filing for bankruptcy because, in her words, being in remission is just as expensive as being in treatment because of the follow-up appointments. She still is on some medications. So just to note that the costs don't always necessarily end. Medical costs do not always end just because someone is in remission. And so lastly, we have disease progression. So usually that's going to look like someone who maybe has a terminal diagnosis, or they just are not sure what their endpoint is or when that's going to come up. And oftentimes this is going to look a little bit more like the traditional estate planning that financial planners do. And so the patient is going to be asking, here are my assets, here's my debts. How can we hopefully have my estate when I pass to be in the green so that I can leave my spouse or children or whoever some money and try to take care of them financially even after I've passed. And so a lot of different scenarios I just went over, but again, knowing where the patient is in their journey is so helpful to coming up with a plan with them. And so here are some other almost miscellaneous considerations that I've got listed here. So the first one being cognitive challenges, such as chemo brain. I'm not sure if you all have heard of that, but that's a very real thing and it's a common side effect of treatment. And so that involves memory loss and inability to think clearly or recall basic info like what their household income is. Maybe they can't come up with that number right off the top of their head. And so having the opportunity for patients to get the information that they need for their planning session ahead of time, they can spend time writing it down when they're in a clearer state of mind, is very helpful. Also, the importance of keeping written notes, which you all have to do, but also sending follow-up emails with summaries of phone calls to your patients has been very helpful for us as well to kind of combat some of the memory issues. The second thing we have listed here are scheduling constraints. So for some people, depending on their diagnosis, uh, being in treatment is almost like a full-time job. They can be in the OPIC, the Outpatient Infusion Center, 9 to 5, Monday through Friday, like you would be in, your office. And so with that, it's probably going to be pretty tough for them to make it to your office. And so sometimes we'll have people who just strongly prefer to do phone calls or Zoom meetings so that they can multitask. They can do it while they're in the OPIC, or let's say they're not in treatment all day, they're just in there for a half day, but they're still tired. We hear all the time, people just want to go home after treatment and sit in their recliner with their dogs. Totally understand. And so again, the importance of offering different methods to meet with people. Some people, of course, are still going to want to meet in person, but also offering Zoom and phone calls is really, really helpful. And then the third thing we have here is helping people adjust to their new financial normal. So, cancer, the whole topic of this presentation, it's financially toxic. Even for people who have always been in the middle income range and have never really struggled to pay their rent or their mortgage before. This can be the first time in some people's lives where they've had to experience that kind of financial stress. And so dealing with that, as well as everything else that's coming along with their cancer diagnosis, is a lot for some people to manage at the same time. And there's also this thing called secondary grief. And so, of course, someone is probably going to have some grief directly related to their cancer diagnosis. Maybe it's anticipatory grief. They're worried about their own mortality. But then there's secondary grief, which is things like mourning the loss of financial security, mourning the loss of purpose. Maybe someone really got a lot of purpose and meaning from their job as a teacher or whatever it is. Maybe they're not seeing their friends at work anymore. So there's many different layers to the grief that people are experiencing throughout this process. And so always trying to have patience and empathy when working with this population is important, because, just because someone is presenting well on the surface, more often than not, there's a lot going on inside. So let's see. And then now we have prognosis, which related to, of course, our prior slide. So for those who have a good prognosis, maybe they just need to get through the next 6 months and then they could get their finances back on track. And so maybe a short-term fix is a better idea. So for example, taking a loan from a retirement account instead of a withdrawal, maybe that's an option that you all explore. But then of course, if a prognosis is not good, if someone's looking at a terminal diagnosis, then the time limit on things is going to be a major consideration to keep in mind. And which also brings us to our next and our last topic on the prior slide, which is focusing on the here and now, or on the other end of that spectrum, they're hyper aware of mortality. And a lot of our volunteers have shared that one of the more surprising themes of working with CancerLINC clients has been, what do they call it? They call it casket humor, I believe, where people, again, the hyper awareness of mortality that's being translated through humor is one way. Sometimes people are not able to find any humor to it, and so they're more in the like, what's the point phase. And so it's always going to be helpful to be aware of some grief resources like support groups or counseling, and Maybe that's not something that you directly are going to refer people to, but if, for example, CancerLINC volunteers, they know if someone probably needs a little help with things like that, they can send them back to our office and we will get them in touch with the resources they need. But if you're working with a cancer patient, again, on your own, outside of an organization like Norah and I's, then maybe just doing a quick Google search and seeing what resources are out there for cancer patients would be helpful to the work that you do with them. And so now we are going to hear from Taylor on some of the more direct strategies that financial planners should use when working with cancer patients.
All righty, thanks, Patricia. Again, my name is Taylor Jessee. I'm a CFP and a CPA, and I've been volunteering with CancerLINC for about 6 years now. And just through over the years, I can personally attest. I mean, just how, excuse me, how personally and professionally rewarding the experience has been, and truly, I mean, through pro bono planning, I mean, you really are making a difference in someone's life. So I can't say enough good things about my experience and just the importance of the work. As we all know, I mean, typically the standard financial planning engagement involves helping someone map out, usually some kind of hypothetical potential future. For example, retirement that could be years or decades away. And oftentimes, especially when we're helping plan for something that's decades away, there's a lot of hypotheticals involved. But we've all seen firsthand how the financial planning process can help provide clarity and peace of mind for even these hypothetical situations that are, could be years and years and years down the road. So, I mean, imagine now when it comes to helping someone develop a financial plan in the midst of a cancer diagnosis, just imagine how much more powerful that clarity and peace of mind can be. So as Patricia mentioned today, I'm here to talk financial strategies for providing financial guidance to cancer patients. So when it comes down to it, it starts like any other engagement. Like Patricia and Norah had mentioned, there's really kind of a delicate balance between balancing the technical knowledge versus balancing empathy and understanding. Patients are understandably going through a lot. I mean, there's countless doctor's visits, medication, all the medical jargon, balancing bills, family life, work. So I found it's important to, not just like dump a bunch of financial jargon, or a bunch of financial homework on people and, expect like immediate action, so to speak. And also, a lot of times, like other client relationships, a lot of times our job is to be, the quote unquote quarterback or the advocate for the client. For example, this was a recent client engagement I had. It was a young widow. She had applied for Medicaid, and it turned out after she applied for it and was approved for Medicaid, she received or all the assets from her deceased husband's estate transferred into her name. So Medicaid is one of those things that's outside my wheelhouse. But my understanding of the situation was that with the inheritance that she received, that would have put her well above the asset limits for Medicaid. So we worked with CancerLINC, got her in touch with an attorney just to make sure, that she didn't have to unwind her Medicaid application, just to make sure everything was good on that front. So I mentioned that because, and this is something I have to remind myself of, all the time, is, as financial planners, I feel like we're kind of like naturally geared towards like wanting to be helpers. Like we feel like we always need to be doing something, solving some problem, knowing the answer to a question. So I just have to remind myself a lot of times, like, hey, you don't have to know everything. Sometimes just being a good listener and being empathetic and being present in the situation is the most helpful thing that you can do for these clients. Next slide, please. Okay, so when we're talking specific strategies for financial planning, where do you start? So where does it, get down to brass tacks? Again, kind of the common theme here is like any other client relationship. The clients, they're going to be at different points in their financial journey. Some may be more financially savvy than others. So I found it's helpful to kind of figure out where people are starting from and to meet them there. To piggyback off of Patricia's section, some sample questions or some like beginning questions to get started. I found it's helpful to ask, where are you on your treatment journey? Where are you on your treatment timeline? What kind of insurance coverage do you have? What is your income situation like? Are you still working? Are you able to work? Do you plan to go back to work? Do you have emergency savings? Another question is, is there anyone else that depends on your income? Spouse, children, family members, that kind of thing. And basically what it boils down to is like, you can't start getting into problem solving mode, quote unquote, without first having a baseline understanding of the client's financial situation, their biggest questions, their biggest concerns. From there, it typically involves into a budgeting conversation. So a lot of times it's sitting down with folks and helping them come up with a budget if they don't already have one. I found it's helpful to have some kind of template or like a mobile app, have some kind of template available that you can refer them to use, and really try to make it as easy, unintimidating, as user-friendly as possible. Because I know it's hard enough. No one really likes budgeting. It's one of those things. So just making it as easy as possible, I found is huge. On top of budgeting, the next thing I found helpful is helping them kind of recreate or create their balance sheet. Usually I don't call it a balance sheet. It'd be something like, hey, like let's write down everything you own versus everything that you owe. Like, what are your debts? What do you owe? Credit cards, loans, mortgage, that kind of thing. And again, the main goal here, we want to make it easy. We want to try to make it not intimidating. And the goal is to help pinpoint, the assets, the tools that they have at their disposal to help address some of their concerns. If it's making ends meet, if they have to take time off of work, if it's paying off debt, or if it's trying to not accumulate debt, just trying to get a starting point for where they're at and figuring out what tools they have at their disposal. Next slide, please. All right, so at this point, we've helped them prepare their budget. We've helped put together a kind of balance sheet. So we should have a pretty good idea of what they have to work with, what the tools they have at their disposal. So from here, usually it's about filling in gaps. So a couple different options I listed here. We'll start on the income side. But income-wise, that could be short-term disability or long-term disability insurance through an employer. There's also some states have their own state disability insurance program, somewhat similar to Social Security disability. Admittedly, I'm not super familiar with these programs. I believe only 5 states have such programs: California, Hawaii, New Jersey, New York, Rhode Island, and also Puerto Rico, I believe, have their state disability insurance programs. So if you happen to have a client that lives in one of those states, certainly something to check out. Of course, there's also Social Security Disability Income, or SSDI. This is generally tied to your work history. So it's kind of like the retirement benefit. So you have to have worked for a certain number of years to qualify for it. And the amount that you're eligible for is also based off of your career earnings up to that point. The kicker, though, is Social Security. They have a pretty strict definition of what qualifies as a disability to receive the income. So on top of SSDI, there's also something called Supplemental Security Income, or SSI. The main difference here is this program, it's not tied to your work history. You still have to meet the same disability criteria. And there's also financial qualifications to qualify for it. So there's generally, I believe, income and asset caps that get factored into the amount that you're eligible to receive. And importantly, important thing to know is you're able to collect both SSDI and SSI at the same time. A quick caveat too. So this is one of those areas that's, a little bit outside my wheelhouse. So this is an area that I do lean a lot on CancerLINC for of, hey, if there's some questions about if a client's eligible for this income, having an attorney or someone who's experienced in this field that can help them kind of navigate that area, I've found has been very helpful. There's a lot of red tape and it can be a pretty cumbersome process. So again, lean on other experts to help you in that area. Some other options I listed here. So it's not, not income in the traditional sense, but there are tons of organizations, tons of charities out there. Case in point, Angel Foundation, who exists to help provide financial support and resources to cancer patients and their family. A few others to name, the American Cancer Society, local organizations like CancerLINC here in Central Virginia, Patient Advocate Foundation, Undo Medical Debt, formerly known as RIP Medical Debt, I believe. So case in point, there's tons of great organizations, charities out there whose, they exist to help provide financial resources to those in need. I also wanted to mention GoFundMe has become a very popular source nowadays. So the thing I wanted to point out here, so generally GoFundMe proceeds, they're generally not taxable to the recipient as long as they're, bona fide gifts, and as long as the donors aren't getting something in return for the gift, those proceeds are generally tax-free for recipients. Another area I wanted to mention here, asking the patients if they've worked with the hospital financial navigator. Hospital financial navigators, these are professionals who work directly with the patients and their families to help them understand their out-of-pocket costs, what their health insurance covers. They might also be able to help set up payment plans, potentially find cost-saving methods for treatments. So they can be a good resource to kind of help navigate some of these financial topics as well. All right, so switching gears now on the other side here. So looking at different asset options. There are several different assets that can be used to help make ends meet. Some of these might be somewhat self-explanatory, so I'll try to maybe focus on the more nuanced ones. The first one I have here listed are HSAs, health savings accounts, and FSAs. The main thing I wanted to point out with here is that you can use an HSA to pay COBRA premiums. So if a patient is in a position where they might lose their employer coverage, but they have an HSA, then you could potentially use the HSA to pay those COBRA premiums. So then that way the patient, the client, they're keeping their insurance intact and they don't have to deal with, starting a new insurance plan, like starting over with a new deductible, new out-of-pocket maximums, that kind of thing. So HSAs can be a great tool. Roth IRA contributions. So we might all be aware, you're able to withdraw Roth IRA contributions anytime, tax and penalty free. The main question is if you're dipping into the earnings portion in a Roth IRA, that's where taxes and penalties might come into play. The nuances of that I think are a little bit outside the scope of today, but I did link a handy IRS tool here on the page here where it's an interactive tool and it helps straight from the IRS website, and it helps you figure out like, hey, if you do take a Roth IRA withdrawal, is it tax-free? Is it penalty-free? So a good tool to keep in your back pocket. The next two choices or next two options here, these might be things to keep in your back pocket if the client, if they don't have any heirs, or if a goal isn't necessarily to leave an inheritance to family or friends. Life insurance policies, that's something to look into, whether there's cash value in a permanent policy, or some insurance policies have accelerated benefits or living benefit riders, to where you could tap into some of the death benefit in advance. Or another option might be tapping into home equity. Again, this could be an option if the client's single, or if there's no desire to leave a house keeping a house in a family or leaving a house as an inheritance for children. So tapping into home equity could be an option via, a traditional home equity loan or a second mortgage, or even possibly a reverse mortgage. So those are options as well. Moving down the list here, so other options could be 401k loan. There are some kind of nuances with 401k loans. So you're limited to only, at most, you can only take a loan of 50% of your vested balance or $50,000, whichever is less. One advantage, since it's a loan, that means it's not taxed. But on the flip side, since it's a loan, that means you have to pay it back. So the thing to keep in mind there is generally you have 5 years to pay back a 401k loan. If you happen to leave your job, or if you're not able to pay it back in 5 years, then whatever the unpaid balance is, that becomes taxable and potentially also subject to the 10% early withdrawal penalty if you're under 59 and a half. So I mentioned that because it may be a riskier option in this case, if your client, if they don't anticipate being able to return to work, a 401k loan might be less advantageous in that case. And then this leads me to the last option, or the last two options here, probably the least advantageous for a couple of reasons, but still options nonetheless. And this would be just regular withdrawals from a 401k or an IRA. In this case, let's assume that they're pre-tax 401ks. With this option, generally a terminal illness or disability, those are generally exceptions to the 10% early withdrawal penalty. But in this case, we'll assuming that they're traditional pre-tax assets, you still would owe income tax on the distribution. The major consideration here, though, that I wanted to make sure we point out, and one of the reasons why this could be potentially less advantageous, is because 401ks, those are generally protected from creditors and bankruptcy proceedings. IRAs, I believe, have some protections as well, but generally 401ks, I think, have more favorable protections. Also depends on your state laws. But the bottom line, if a client is debating whether or not to file for bankruptcy or taking a 401k withdrawal to pay off medical debt, like this is a situation where you would really want to loop in a qualified bankruptcy attorney to help weigh those pros and cons. Next slide, please. All right, so now shifting gears, some strategies, beyond dollars and cents. What are some other planning strategies to keep in mind? Estate planning is of course a big one. And this kind of goes back to the idea of helping them get organized. And one thing I wanted to point out, so estate planning, it's important, of course, for the client, but it's also important for other family members as well. And I'll dive into this in a second. But when we're talking estate planning, of course, we're talking about a will, power of attorney, medical directives, possibly a trust. If the client has minor children, you want to make sure that they have guardianship designations for the kids, and also reviewing beneficiaries on accounts, on insurance policies, and also some states allow you to name beneficiaries on real estate, so on your house. Here in Virginia, it's called a transfer on death deed that you file with the county. So I found that to be helpful as well, basically putting beneficiaries on anything that you're eligible to put a beneficiary on. Going back to my other point about, it's important to involve the whole family in this estate planning conversation. Recent example, I was working with a client, and she had a cancer diagnosis. She was on Medicaid, but it turned out her elderly father happened to pass away in the same year, and he left her a sizable IRA. So had we had conversations earlier, this might have been one of those conversations where, hey, maybe the IRA, maybe the beneficiary should be a special needs trust, or maybe, I guess what it gets back to is you wouldn't want, if someone's on Medicaid, for them to inadvertently inherit assets that then put them over the resource threshold to qualify for Medicaid. So kind of just making sure everyone's on the same page. There's also some tax planning ideas. At first, I found in general, it's helpful to review the client's tax return. It's possible that they might be missing credits that they were eligible for. For example, the earned income credit, like if they had to take time off of work, or they could be missing medical expense deductions, Schedule A, which we'll dive into in a second. The other thing I don't want to overlook is it's also possible that the client they haven't been filing a tax return, even though they would have been owed a refund in those years. This was a real life example. A couple years ago, I was working with a client, and we found out she hadn't been filing a tax return. Her only income was Social Security, but she was having tax withheld from her Social Security benefits. So we talked about it, we figured it out, and she was able to go work with another pro bono tax planner, and she was able to file some of those old returns, and she got those tax withholdings back as a refund. So that was a big win for her. Tax deductions for medical expenses. So the big one here would be Schedule A deductions for unreimbursed medical expenses over 7.5% of your AGI. I wanted to point out, so this includes, of course, doctor's visits, copays, prescriptions, but it also includes transportation and lodging expenses for medical care. On the transportation front, there's either a standard mileage deduction of, I believe, 21 cents per mile, or you can deduct your actual expenses, such as gas, tolls, oil changes, that kind of stuff. And it works similar to how Schedule C business owners, it's somewhat similar to that deduction. And then for lodging, the caveat here, so that would be for like a hotel stay, you're only able to deduct $50 per person per night. So for example, patient and their spouse traveling together, that would be $50 per person, so $100 per night. And then the last tax strategy to keep in mind here, this would be kind of a more advanced strategy, but in lower income years, if their prognosis is good, if they plan on going back to work, if they're in remission, maybe engaging in Roth conversions in the years where they're in a lower tax bracket to kind of take advantage of that lower tax bracket. And then what I wanted to close with here, so some final resources. One resource I lean on all the time, it's called FP Pathfinder. If you haven't seen or heard of them before, it's basically a whole database of flowcharts and checklists for a whole bunch of different financial planning topics. Of relevance for today, there's a terminal illness checklist, there's an SSDI checklist, unexpected expenses checklists, and there's also some flow charts for helping figure out if distributions from inherited IRAs or traditional IRAs are taxable. So yeah, FP Pathfinder, I found those are helpful for pretty much any client meeting, but certainly for the topics that we're discussing today, it's been a great resource. So that's all I had. So now I'm going to hand it back over to Norah, who's going to share a few more resources and a client story.
Thank you so much, Taylor. As Taylor mentioned, there are a number of nonprofits around the country that can be a resource to you as you work with cancer patients. Three that we wanted to highlight today are national nonprofits. The first is the Cancer Financial Assistance Coalition. It is, of course, a coalition of many nonprofits that help patients manage their financial challenges. It includes the American Cancer Society, the Taylor referenced, which is likely the largest nonprofit serving cancer patients across the country. There's also Triage Cancer Care, another national nonprofit that helps cancer patients navigate legal, financial, and insurance-related questions. It has a plethora of amazing videos, amazing white papers. It's just an extraordinary resource. It can be a little bit overwhelming to patients, so it might be something that you might want to look at to help curate for them about where they might want to go, but it is extraordinary. And then last but not least is the Health Well Foundation. Provides financial supports to help patients who are insured but unable to afford their copays, their premiums, deductibles, and/or out-of-pocket expenses for essential treatments and medications. We wanted to end today by talking about a patient. We wanted you to actually hear from a patient. Victoria was a patient of ours at Angel Foundation in 2021. She was at 34, working towards financial freedom with her partner, and she was diagnosed with stage 3 breast cancer. Given her diagnosis, she was given a very aggressive and very expensive treatment plan. Her first chemo bill was almost $80K, and she needed to take many months off in order to receive the treatments. So she enrolled in the FCC program, and I want you to hear now directly from her. We play this actually at the start of all of our workshops because Victoria really speaks to the patients about the importance and non-judgmental work with CFPs that really helped her. So I'll let her take it away now.
Cancer is something I didn't plan for and most definitely wasn't prepared for. I was actually working towards financial freedom when I was hit with my cancer diagnosis and numerous bills. You know, it felt like a huge setback, and I didn't know how to navigate this financial burden. So for me, the financial cancer care program with the Angel Foundation was essentially what I needed. You know, being able to work with a financial planner, someone that's compassionate, willing to hear your story, understand the impact cancer can have, and help you strategize your finances to stay afloat was so helpful. I mean, we identified areas of strength or challenges with me and my finances. We created budgets. You know, the planner actually met me where I was at in my financial journey, and you know, they were willing to offer recommendations on my financial situation, and it was all judgment free. I mean, I feel like that's something that's so, you know, important when, you know, finances can be a very uncomfortable topic and an area for people to address and even be vulnerable with somebody with. But you know, just them taking the stance of being judgment free was just so important. And you know, through this I was given some tips and tools I needed, and I absolutely ran with it. You know, it felt like having an accountability partner, and it was at no cost to me. You know, in it all, it was very rewarding to see the progress I was making, and I'm happy to say that I'm back on track towards financial freedom. And so a program like this is definitely needed for anyone battling cancer, so that your financial burden is no longer the focus, and instead the focus becomes, you know, your healing and your overall health. So just know that, you know, there are resources to maintain control over your finances and focus on your health, and the financial cancer care program will do just that. So thanks. Bye.
So I'm very glad you got to hear from Victoria. Victoria is an extraordinary human being, of course, but I think this is a really strong testimonial to the important work of these programs and to pro bono CFPs working with cancer patients. I'm so grateful for your time today. I know that you all, you know, took a nice lunch break to be here, and we're really grateful for that. I will turn it back over to the FFP team to close us out.
Thank you so much, Norah. Thank you so much, Taylor and Patricia. We are so appreciative of you being here today and sharing all your knowledge and resources on the impact that pro bono financial planners, other financial professionals, and nonprofit professionals can have on people with cancer and their families. So we very much appreciate you taking the time today. I wanted to just share the 2 volunteer opportunities. You can see the QR codes here with Angel Foundation and CancerLINC. So if you want to learn more, you can be in touch with me. You can be in touch with any of our speakers, and you can check out the volunteer opportunity listing on our platform, probonoplannermatch.org. In terms of some housekeeping today, FFP will provide the CE credit for all of our CFP professionals in the audience. So we'll report that for you. If you're an AFC, you can use the code FFP FFP21, and Jordan can put that in the chat. It's FFP21, and that's for you to report to AFCPE to get your credit. CFP professionals will do it for you. So thank you again for being here. I'm sorry we didn't get a chance for questions, but I hope you've found this helpful, and we will be sending out the recording and the slides later this week. Thanks again.